So, thank you for tuning us in. And my guest today is Dr. Gerald Deas, medical doctor and an internist, and we're in Queens, New York. The excitement, let me introduce you first. Dr. Deas, thank you for taking the time just to talk with us today. I'm excited just to begin with because you said you make house calls. How is that still possible in the 80s? Because nobody still does that.
Well, in becoming a physician, one thing I always determined that I was going to do is serve the public. In fact, that's why I'm still sitting here on the corner of Hollis Avenue and 197th Street in Hollis, Queens. And I live in the same house and so forth, live in the same community. And I deal with the same community, in schools and the churches and things like this. And it's very hard if you're dealing in that community, living in that community, if someone gets sick and they call you and you say you don't make house calls. Well, I mean, that's like the plumber saying I don't come and fix your leak, or the carpenter say I won't come and hang your door for you. And so I have carpenters that come and hang my door if I need them in the middle of the night, or an electrician that will do this, or a plumber that will do that, because they know I will reciprocate. So basically, when you live in a community, bigger or different than anybody else.
Right. What do you think we got away from that? Because I mean, as a kid, growing up in Ohio, we had my childhood doctor did house calls, but after that,
I think it almost became a financial thing. A lot of people, a lot of doctors might think, well, I can see the patient quick in my office and see many more patients. They give that as an excuse. But when I go to see an elderly person laying in bed who's restricted to the bed because of severe arthritis or a stroke, or a person who's, say, so nauseous that they can't even leave the bed, they're vomiting or they have diarrhea and they can't even get to an office or a hospital, I feel very good going into that home and examining them and prescribing for them. So, and they appreciate it. It's nothing like a person giving you that look. It's not even the payment they give you. It's the thank you that they give you.
Right.
Appreciative. And I think that's what life is all about, is getting people to really appreciate you, and feel that need.
And being able to share your services. No, I commend you. Like I said, that's a rare breed. That's enough to conclude the interview, because everybody's going to be in a state of shock. They might not hear the rest.
But as I say this, that life is so short that if you're in any profession, give your all, give your best. Because I have a poem that I recite to young kids, and I say, if I owe you, you owe me. We owe each other. If you owe me, I owe you. No need to call me brother. And that's what it's all about. If you're going to call somebody brother, be ready to be a brother.
Right. Be ready to be there. This interview has been in the making for 2 years because we keep missing each other.
Yes, right.
And my first learning of you was that your work with sickle cell anemia, and I guess I really got to get back to the basis, because I'm unaware exactly. We hear about it, but its origins, its history, how it affects. Does it still affect blacks? Maybe you just give us a little history of what it actually is.
Sure. Well, sickle cell anemia is basically a disease of the blood where the cells, which normally should be the shape of a donut, they go into a sickle shape, the shape of a feather, say, for example. That's the best I can describe it. And when they go into that shape, they get destroyed easily in the body, because they're removed, because they're imperfect cells, and so a person becomes anemic because they're removed much faster than a normal cell. A normal cell might last 120 days. A sickle cell might only last 60 days.
Okay.
And when those cells sickle like that, or go into the shape of a sickle or a feather, they jam small blood vessels, small capillaries. The small vessels are going to the eyes, to the different organs, to the bones, and things like that. And when they jam like a log jam, if you can think how a log jam a stream, and the water can't go by.
Right.
Then therefore the blood can't get by.
It starts trickling.
That's right, and certainly you get a lot of pain. And of course, getting this pain, that's the most severe thing, is getting the anemia, and number one, getting the pain. And of course, they can pick up sickle cell anemia right now, even possibly maybe after 6 months after birth, because there's a certain amount of hemoglobin in the infant that protects you from sickling. Called fetal hemoglobin, but after a certain period of time the fetal hemoglobin disappears and you get a regular normal hemoglobin. And if this is sickle cell hemoglobin, that sickle cell hemoglobin will sickle at a certain time. If the oxygen, say, goes very low, in the body, or if you go in an area where the oxygen is low, that if you have sickle cell anemia, those cells might sickle and so forth. If you go under surgery and say the oxygenation is not good, that the anesthetist is giving a person, they might sickle and things like this. So, but you can have sickle cell crisis at any time. We don't know what brings on the crisis.
Yeah, I was going to ask you, is it a contagious?
It's not a contagious disease. No, it's a genetic. It's a hereditary disease. It's a genetic disease. The mother and father must have the trait for the child to get sickle cell anemia. And there's a certain way that you can almost genetically counsel someone. If they come in and each parent has the trait, well, you can say, well, 1 out of your 4 children will have the disease.
Okay.
And so it's a trait. A trait is a genetic marker in the body.
Okay.
Like if you have a hemoglobin that has an S trait, and 2 S traits get together, you get sickle cell anemia. And of course, 1 out of 4, if you have 2 sickle cell trait parents, you'll get 1 out of 4 children having the disease.
Is it just a black disease? At one time, I was hearing only blacks get sickle cell anemia.
No, it seems like it runs through the Mediterranean, wherever the malaria belt was, through Africa, through Mediterranean, through Greece. They find it, but mostly in Africa. And with the slave coming over to America, they brought the trait or the condition with them. I wouldn't say they brought the condition, but they brought the trait with them, because if they had the condition, they might not have survived. You see, the long trip and so forth. They have full-blown sickle cell anemia. So they brought the trait, and of course that set up the sickle cell anemia. But sickle cell anemia today is not a disease that we look to say it's going to end your life and things like this.
So there is treatment.
Oh, treatment. There's a lot of treatments. We find that if we take a sickle cell patient, I have patients who are in their 40s, going into their 50s almost now, because if you take care of infections early, if you take care of the person's nutrition good, if you give them adequate medication when they need it, rest, and all the other things, they do very well, and they go on. I'm sure they're going to go on for a full length span, even with the disease, but we do have methods to treat it with also.
So let me, while we're talking about illnesses, let me get on the other one that seems to plague blacks. Well, it probably doesn't just plague blacks anymore, but the high blood and the hypertension. Right.
Well, you know, I'll tell you, even before we get into that, another anemia that's even more prevalent than sickle cell anemia in blacks is the anemia caused by eating of laundry starch. You know, you've heard people eating Argo laundry starch.
I heard of that.
Yeah, and people, they say, well, it's in the South. No, it's in the North, it's in the South, it's in Panama, it's in Africa. Eating of laundry starch also causes anemia. And how that causes anemia, by eating the starch, it goes down the intestinal tract and it binds the iron and prevents the iron from being absorbed to produce red blood cells. So the woman goes around, and usually it's done by women and not men in the black community. They go around with hemoglobins of 7 and 8 rather than 12 or 14, and they eat it a great deal during pregnancy. And we don't know really the full impact upon pregnancy, but we do know that the child can be affected this way by the eating of laundry starch. But that comes from an old custom of eating clay in Africa. In fact, one of the main things that slaves used to commit suicide is the eating of clay, because clay also does the same thing as the starch, causes anemia. And when they couldn't go out into the field and work because they were so anemic, this of course used to make the plantation owner quite unhappy about that slave being sick like that. So eating of clay, eating of starch causes anemia. And all through the South right now, people still eat clay, red clay, white clay. And they can't eat the starch now because the work that I did with Bill McCrary here in the city, we caused the company, or made the company, produce it in a powder form. You see, it was only attractive if it was in the lump form.
That's what I was trying to remember if I...
Yeah. And
blue box.
A blue box, that's right. And the grinding of it between the teeth. That was the thing that was very satisfying. It's grinding it between the teeth. So we got it made into a powder. The company now makes it into a powder. And the black women are not attractive to eating it anymore.
Yeah, you can't.
Yeah, right.
You can't have the fun with
That's right.
That's a good insight.
But certainly getting into hypertension certainly plagues us. But I would say hypertension itself is more than just a medical disease. It's a sociological disease too. It's a disease caused by stress. And black people, under the warehousing, the way they are made to live, and so many of the projects and poor diet, we ate a lot of salt-containing foods because they're tasty. So therefore, if you go into any mom and pop store, the main things that are sold are pork skins and potato chips, and all the things that are crunchy. When you say starch, crunchy potato chips, crunchy peanuts, crunchy pork skins,
You're right.
and all those things have so much salt in them, and our children get addicted very early to these salt products. You know, and when
it's so accessible,
and cheap. Don't forget
That's
cheap,
right, cheap.
because
That's
you can
right.
get a quarter bag of anything, and anybody can get a quarter today. All you do
That's
is wash
true.
somebody's car window, you got a quarter.
That's
You know,
true. If they'll go work,
right?
that was a problem. That's a big problem we've had, is trying to get a lot of our young people to actually work. We've come across. I mean, I don't even know if you've seen a lot of our kids. A lot of our parents are working 2 jobs, and they're
Yes.
compensating the kids by
Sure.
giving them the money
The money.
because they're not there, and so working is like, what? What's
Yeah,
a job?
right. You know, in fact, many times I tell the people that when you sacrifice a kid for extra broadloom or an extra television set or that extra car in the family and so forth, you sacrifice a lot for that child, for not bringing up that child. My mother did domestic work as well as she was a laundress. But you know, one thing she was at home. And when I got home, to see her even washing clothes, and I would deliver the clothes when I came home from school, it was still a restful thing within myself to know my mother was there, you know. And we didn't have a whole lot, you know. We didn't have rugs on the floor. We had a rug on the floor, but certainly not the kind of rugs I see when I go into folks' homes, the way it's decorated. Chandeliers and all these kind of things. Looks like the houses are rich and famous when I go into just little houses.
Right.
And I know they're putting a lot of money into that, you know. So, but